Welcome to another lecture of Psychology 101. This is your instructor, Dr. Shadi Bashai. And in today's lecture, we will continue talking about stress, coping, and health. It's the second part of that particular unit, and it corresponds to Chapter 12 of your textbook. So here we go. So in the last lecture, we mostly discussed stress and its impact on the body and on the mind. In today's lecture, we will focus more on coping with stress and coping management and stress management strategies. So it turns out that our intuition about wanting to be around people during times of stress is a pretty good one, especially when it comes to our mental and our physical health. So social support is defined as the relationships which you foster that can provide you with emotional support, comfort, and even personal, financial, or tangible resources. One of the most impressive studies that have been conducted on how social support can predict death of all causes was done by Berkman and Syme. And it was a longitudinal study, meaning they examined or assessed the same group of people over a very long period of time, which longitudinal designs tend to be stronger and more rigorous than other research designs. The researchers found that social support predicted mortality, meaning death from all causes, and this was true even after accounting for the initial physical health status of the participants. So social support acts as a buffer to stress as well as supportive to things like mental and physical health. There are a number of avenues that people can take to cope with their stress. One avenue is to increase one's sense of control over the stressor. So there are various types of control that you can actually engage in. There is behavioral control, which basically looks like you actively doing something to manage the stressor, which is similar to the concept of problem-focused coping we talked about in a previous lecture. That is, if there is a stressor, let's say there's an upcoming exam, you devise a plan of action to deal with the stressor. Let's say you plan to study for the weeks leading up to the exam, so that would be behavioral control. When people engage in this form of behavioral control, they're actually less likely to resort to maladaptive or unhelpful coping strategies, such as drinking or resorting to recreational drug use or other things that may be damaging. There is another form of control one can practice to manage stress, and that's called cognitive control. And this is when you cognitively restructure and rejig your thoughts, basically, to lessen the impact of a stressor on yourself. So if you and your partner broke up, for example, you might think differently, restructure the situation by, for example, thinking of the upsides of being single. So that would be an example of cognitive restructuring, cognitive control, changing your interpretation of a situation so that it is less impactful, less stressful. Here's an example of cognitive restructuring or cognitive coping in action. So I challenge you to take a minute or two to ponder the following two scenarios. As you will soon note, how you think about the same situation can determine how much stress and angst you feel as a reaction to that situation. In the first example, there are a lot of negative thoughts about the future. So, for example, I will never find a partner. Lots of worries about current situation. How can I get the bills paid? And in the second scenario, the threat is almost interpreted as an opportunity, as a challenge. This could be my chance to travel after losing one's job. So here's an exercise that I'm going to challenge you to do when you get a chance. Pick between a behavioral stress management strategy and a cognitive control stress coping strategy to help you manage the stress related to an upcoming exam or assignment. There are other forms of coping we can also engage in besides behavioral and cognitive. There is something called decisional control, which simply means having to pick between several options, and simply having the choice between several options has actually been shown to lessen stress reactions and subjective ratings of stress. There's also informational control, which is defined as getting information about a stressful event so that you can manage the stressful event even before it happens. For example, if you're stressed out about a presentation you're about to give, you find out a little bit more information about the audience, the venue that you'll be presenting in, and how you're going to get to that venue. This is also called proactive coping, as it helps you anticipate stress and manage it before it rises to intolerable levels. Finally, there's emotional coping, which is related to either expressing emotions and reactions of stress or suppressing your reactions or emotions related to stress. Suppressing it means you hide any indication about what you're actually going through, and you don't talk about it with anyone at all. A famous psychologist by the name of Pennebaker, he devised the type of therapy and he called it writing therapy. Pennebaker and others showed that through the research that the appropriate expression of emotions and stress reactions, for example, through writing in journals, can actually help give a soothing and healing effect to people who are quite stressed out, especially amongst people who have dealt with trauma in the past. So writing about their trauma seems to be quite helpful from these Pennebaker studies. There are, of course, other forms of coping, and that is in the form of acceptance. So the power of acceptance is harnessed by a number of new wide-reaching set of psychological therapies called mindfulness. And mindfulness uses forms of acceptance which is defined basically as adopting an open, accepting, and non-judgmental attitude towards the full gamut of present moment experiences. So either they be negative or positive. So just adopting a very open stance towards all present moment experiences. And the basic idea is that lots of people are stressed about their stress. That is, people notice stress and perpetuate it by struggling against their experiences. So mindfulness turns this on its head, if you will, and teaches people to accept, be open, and lean into their suffering almost. There's a particular form of stress training, and that's called stress inoculation training, which is sometimes provided to people like first responders or people who encounter very stressful events regularly throughout their jobs or their lives. Stress inoculation uses the power of practice and planning to help people build, quote-unquote, an immunity to future stressful situations. Stress inoculation proceeds in 3 phases. In the first phase, which is called the conceptualization phase, people are taught to develop an understanding of the nature of the stress process itself. And in the second phase, the trainees are taught important skills, coping skills, and are asked to rehearse these skills in a mock stressful situation. And in the final stage of the stress inoculation process, which is called the follow-through, the trainee is actually put out into the field, and their skills are, the skills that they gained in step 2, are tested in real time. Beyond coping strategies that people can use to manage stress, there is research that suggests that we all have different levels of certain traits that make us more or less likely to be able to manage stress effectively. One example of this is a concept called hardiness. Hardiness is a set of attitudes it's almost a sense of control that people have over events, feelings of commitment to life and work, and the courage to face or confront stress or anxiety. As you can probably guess, people higher in this concept of hardiness, so they're showing elevated control and engagement and an orientation of challenge to threatening situations. The research has shown that people higher on this particular trait of hardiness manage stress more effectively than other people who may be lower on this particular protective trait. So this protective effect of hardiness was replicated in many studies, and it was replicated with studies with managers, for example, nurses, immigrants, and the research really showing the same thing, which is higher hardiness means more effective stress management. One important limitation of this construct, though, is that it's kind of conflated or mixed up with a number of other important constructs. For example, something called locus of control, which is, again, people's sense of control over their circumstances. So the construct is conflated, kind of mixed up with other important constructs that we know predict reactions to stressors fairly well. There's another important individual difference that helps determine how people respond to stressors, and that's their level of spirituality. Spirituality relates to any search of the sacred or any attempts to make a connection with the divine, if you will. Intrinsic religiosity is when people engage with religion just for the sake of engaging with religion and just for the sake of the fulfillment that they get out of this engagement, instead of being motivated by some social or economic factor, which is called extrinsic religiosity. So it turns out intrinsic religiosity can protect people from stress, sometimes also makes people less likely to engage in maladaptive or unhelpful stress reduction strategies. Again, we talked about those a little bit in a few slides ago, which are things like drinking, recreational drug use, etc. So we don't fully understand how spirituality and religiosity can do that, can help people manage stress. But there is some research which suggests religiosity can promote people's sense of self-control. Religion can also be a source of social support in and of itself, as religious people are often part of larger community, and finally, larger communities, and and finally, religion can give people a sense of meaning. And all of these factors have a positive impact on stress management, of course. So we talked about individual differences that can protect people against stress. Let's talk about individual difference factors that can actually make the stress worse for a lot of people. One of these is called rumination, and rumination is a type of thinking style that's typified by repetitive thinking and repetitive attempts to try and understand reasons or consequences for why you have the problems that you do, for example, or the worries that you do. People's tendency to ruminate is very much related. People's tendency to ruminate, is very much related to stress, of course. And the more people do it, the more likely that they report heightened stress. So it turns out that rumination is what we call a transdiagnostic factor, meaning it's one of those factors that contributes to a number of different mental disorder diagnoses. So it goes beyond just one diagnosis, including predicting depression, anxiety, eating disorders, etc. So it is a common thread, if you will, in all of these disorders. Rumination has also been linked with actual physical health, including cardiovascular health. And it's one of the reasons why women who typically, so at least this is on average, women typically ruminate more than men, and that is an explanation as to why, or at least a partial explanation as to why women are at a heightened risk to develop depression. So I hope I've demonstrated to you that our psychology very much matters in determining even our physical health. There's a branch of psychology, and that's called health psychology, which specializes in the scientific study and understanding of the relationship between biological, behavioral, cognitive, social aspects of health and disorder and disease. This field has been very, very influential in health promotion campaigns, for example, especially the health promotion campaigns that were against smoking and obesity, for example. Let's talk about smoking for a second. As you may already know, smoking is the leading cause of preventable death and disease in the world. As mentioned, health psychologists and research from the field of health psychology has been very influential in providing people with education and with plans to help them quit smoking over the last few decades or so. Similarly, health psychologists and research from the field of health psychology have been very influential in helping people manage their alcohol consumption. We know from the research, for example, that chronic over-drinking or binge drinking in excess is associated with several problems, either they be physical or psychological. There is some research which actually suggests that drinking moderately, so a couple of drinks a night, is associated with improved physical and mental health. But there's a bit of controversy around this particular set of studies, because these epidemiological studies, which are very large representative sample studies and are often correlational in nature. See, the epidemiological studies show us that the moderate drinking is helpful, but often fail to account for an alternative explanation, which could be a third variable associated with all of these variables, which is the fact that people who drink moderately happen to also have higher socioeconomic status, which means these people also have better access to healthy food choices, to exercise options, etc. So there's a bit of a controversy around this moderate drinking equals health literature. Obesity is the new frontier for health psychologists. The rates of obesity are nothing short of staggering. 10% of all children, 25% of all adults are considered obese, which is having a BMI of over 30. It goes without saying that obesity is associated with a number of physical and emotional issues. Add these facts with the fact that people in the West are obsessed with thinness and they chase relentlessly after the thinness ideal. So the weight management industry and the weight loss industry is a very booming industry in the Western world. Health psychologists and health psychology research has shown us that both low-carb and low-fat diets work. So there is no best diet. The best diet really is the one that people can stick with over time. So the one that people can be consistent with over time. As most people seize their weight management strategies and regain all the weight back, and in fact the estimates are only about 20% of people who have lost a significant amount of weight, which is more than 10% of their body weight, can actually manage to keep the weight off for a long term. And actually some of these figures come from stats on contestants in TV shows such as The Biggest Loser. So they followed about 20 of them around for a number of years and found that out of the 20, only about 4 or so maintained the weight loss. Here are a few weight management tips based on the latest health psychology research. Nothing here really that's out of sync with our common sense. Exercise is good, turns out. Monitoring calories is also good. High fiber foods are good. Social accountability is good. Control of portion size, Also good. Research is also showing us how powerful exercise can be for both physical and mental health. Regular exercise, which is defined as about 150 minutes or more of aerobic or other physical exercise. So that kind of a regular exercise is related to lower blood pressure, reduced risk of cardiovascular heart disorder, reduced risk for a bunch of cancers, and reduced risk for diabetes. There's emerging evidence that exercise can actually have a pretty significant antidepressant and anxiolytic or anti-anxiety effect. And it can even be an very important buffer to stress. Some of the work on the power and the effects of exercise actually come from researchers right here at the University of Regina. Some cutting-edge stuff that's happening. So with all this knowledge that we have about what makes us healthy, what makes us happy, and what makes us productive, why the hell is it so hard to change? There is this thing, it turns out, called personal inertia, which is the fact that it is just really hard to change your baseline behaviors because your mind and your body get comfortable with the baseline. It's also really hard to change because we often underestimate the risks involved for ourselves. People often use the availability heuristic, which we've discussed in the past, which means they judge the probability of something occurring, such as heart disease and strokes, etc. They judge the probability of a health issue or a health risk occurring based on how fast it comes to mind. When making health-related predictions, for example, death by stroke is far more common than death by car accidents, yet examples of death by accidents come readily to our minds, and so they skew our perception of their likelihood. Death by digestive cancers, for example, is also far more likely to happen than death by all car accidents combined. Again, that pesky little availability heuristic makes you think otherwise. Because it's sometimes hard to change baseline behavior, we can turn our efforts towards preventing problems well before they even occur. We can, for example, educate people about the effects of poor eating, smoking, drinking, in the hope that they won't engage in these behaviors to begin with. We can educate them about more positive alternative behaviors that they can engage in, like how to eat right, for example. We can also teach them to resist peer pressure and expose them to positive role models who can model the appropriate health behaviors. Unfortunately, there is something that many prevention programs that aimed at health promotion can actually backfire. So there's some research to suggest this. And I'll give you an example. So there's the example of the DARE program, which is a type of program that tries to teach at-risk youth about the dangers of recreational drug use by scaring them about the possibilities, the future possibilities of continuing in this path. So this tends to actually work in the opposite way, it turns out. Kids in the DARE program show an increased risk of engaging in maladaptive health behaviors and recreational drug use. So it can sometimes backfire. We can rely on Western traditional forms of medicine to manage our stress and maintain our health, or we can turn to alternative approaches that replace or supplement conventional approaches. We call these approaches complementary medicine, as they are approaches used to complement or supplement traditional medicine approaches. Here are percentages of people in the population who resort to alternative or complementary medicine. As high as 18%. Use of natural products such as vitamins and minerals, and as high as 10% use meditation, 9% use chiropractic kind of approach and related methods. There are biological, alternative, or complementary medicinal approaches. And this is basically related to consuming herbal supplements and vitamins and minerals and stuff like that. This approach has been used throughout history as a remedy for common psychological and physiological conditions. And for example, St. John's wort is based on a naturally occurring substance and has been traditionally used to treat symptoms of depression. Acai berries has been claimed to help people reduce or manage their weight, and ginkgo biloba was believed to help. That's a fun word to say. Ginkgo biloba was believed to help people's memory and cognition. There's actually very little research to support such claims, mind you. People who have also taken vitamin C for cold symptoms. Turns out vitamin C consumption is related to the prevention of cold virus, but does little for cold symptoms once you actually have the cold symptoms. Not only are some of these approaches not supported by science in their claims, but they carry a risk given that they're not regulated by Health Canada. So they just simply don't go through the rigors of traditional medical products. As many as 9% of people engage in manipulative methods such as chiropractic manipulations. So these are manipulations related to the spine to help people relieve things like back pain and neck pain. Chiropractic is based on a theory called subluxation, which, so the theory states basically that disorder and disease ensue with an inappropriate alignment of the spine with the body. There have been no research studies to support the theory of subluxation at all. Further, is actually evidence that chiropractors and other manipulative techniques and manipulative methods can actually do more harm than good. For example, there are studies showing that the incidence or new cases of strokes increase just after people visit their local chiropractor. And this is not to say people should not be using these approaches, but that extreme caution should be practiced when doing so. There are other forms of alternative or contemporary medicine, such as techniques related to mind-body connection, for example. Biofeedback is one type of such approach, and what it does is it gives patients real-time feedback about basic physiological processes, such as blood pressure, breathing pace, heart rate. So it gives them real-time data on what those are, and gives people an opportunity, therefore, to practice or control these functions. So bring a volitional control, for example, to lower their blood pressure. The effects of biofeedback therapy is, at least this is what the research is telling us, is no better than effects achieved through relaxation therapies or just sitting quietly for a while. Meditation is another form of alternative and complementary medicine that harnesses this mind-body connection. Mindfulness, unlike the other things that we've been talking about, has been studied extensively and has been shown to have positive effects both on our physiology as well as our psychological functioning. So that one is backed by lots of research. Energy medicines are a branch of alternative and complementary medicine that claim that energy, sometimes called ki, so energy flow throughout the body is important for health. So that's the big claim. So these approaches try to help patients relieve pain, for example, by allegedly relieving energy blockage throughout the body. An example of this approach is acupuncture. And again, there's no scientific evidence that's available to support that energy blocking theory of health. There's simply no support for that particular theory of health. And it turns out that things like acupuncture do no better than placebo in relieving pain. Now let's zoom out and evaluate the alternative and complementary medicine approaches as a whole, if you will. Many studies show that the effects of alternative and complementary approaches is no more than just a placebo, related to simply people's expectations of getting better or finding relief when they're taking it. if you give people sham acupuncture therapies, for example, which look like acupuncture but is actually a fake version of it, people still experience the same level of relief from things such as back pain, migraines, when compared to even real acupuncture. We know, for example, that a large portion of experienced pain has to do with psychological factors. So complementary and alternative approaches remain popular because they appear to help people, but science is showing us that they're really no better than placebo. Just like pseudoscience, these alternative approaches are so popular because they can instill hope in people who are suffering. Not only that, the popularity of these approaches is linked to people's belief that what's natural must be better. So they see no negative consequences of engaging in, for example, taking vitamins and minerals and stuff like that. People also make illusory or false correlations or connections. So they often use traditional medicinal approaches in conjunction with alternative and complementary medicinal approaches. And so they use these approaches together, and when they notice improvements, they attribute the outcomes to alternative medicine and not to the traditional medicine that they're actually also consuming and maybe helping them. And in fact, there's more evidence to support that these traditional medicinal approaches are the ones that are helping. Finally, people continue to use these complementary approaches because there's a lot of misinformation out there about diagnoses, for example. And oftentimes, the people who do take complementary medicinal approaches are ones that are not meeting criteria for certain issues, that they're just showing signs and symptoms, so the severity of the problem is just not as magnified as if it would be in somebody who's diagnosed with an actual condition. Until next time.